Fentanyl crisis is so dire, New York State is sounding the alarm.
If you think anyone knows how much fentanyl is in their drugs, you're dead wrong. You can't see it, can't taste it or smell it, but there are ways to detect it.
That's a new public service announcement warning people to test their drugs. But fentanyl is impacting every neighborhood around the country, and the consequences can be devastating. Dr. Nidhi Kumar is on call this morning and says now is the time to talk to your kids about this deadly drug. Good morning to you.
Morning.
Thanks so much for joining us. How dangerous is fentanyl?
It is the leading cause of death for Americans under the age of 50 right now in the United States. It is touching every neighborhood in this country, and it's just 2 milligrams of fentanyl that can cause an overdose. That's the amount of 1 grain of sand.
Oh, that's really incredible. When we say dire, we really mean it. Fentanyl is being mixed into other drugs. Why is this happening, and what are doctors seeing in the ER?
Okay, so what we're seeing in the ER are 2 phenomena. First is counterfeit medication. So people think that they are purchasing Vicodin, Xanax, Adderall, you name it, illegally, and instead it's fentanyl. The more concerning thing even that we are seeing is that fentanyl is being mixed into other drugs, in particular marijuana. And now there is a lot of marijuana use, and there's this perception that marijuana is safe because it's now legal. But fentanyl is being mixed into marijuana, and that's because it is 50 times more addictive than heroin, 100 times more addictive than morphine. So it's a way for drug dealers to get people hooked, and as they use it, they need more and more increasing doses to get that same high.
So last week we saw New York State launching this public service campaign trying to get the word out in regard to fentanyl. Why is it so important now for parents as well to understand the dangers of these drugs?
Okay, so we are in a public health emergency right now, and like we said, this is touching every neighborhood in our country. So we need to share information with the young people in our lives. We need to let them know what's going on. Anyone who has a smartphone has access to a drug dealer at this point, and drug dealers are going on these gaming sites, these social media sites. Additionally, there's harmless reduction programs in to test drugs for fentanyl. So look, I don't want anybody to use drugs, but if someone is going to use a drug like marijuana, you want to obtain that from a legal source. And if you do obtain it from an illegal source, there's really a push to test for fentanyl.
So the antidote of fentanyl overdose is Narcan. How accessible is Narcan nowadays?
Well, Narcan can be purchased without a prescription, but there are so many programs now where you can obtain Narcan no cost, which is really a very important thing. I mean, at this point, Narcan should be thought of like an AED. It should be available in all public venues, in workplaces, in schools, and probably in every household in the United States.
Well, Dr. Nidhi Kumar, thank you very much. Appreciate you taking some time to talk to us about such an important issue.